quality in Singapore is in the moderate range today after hitting unhealthy levels over the weekend. The National Environment Agency says hazy conditions could remain for the rest of the month, with the dry weather in the region likely to persist. At 8 p.m, the 24-hour Pollutant Standards Index, or PSI, was highest in the south at 85 and lowest in the east at 76. But the hourly PM2.5 readings, which measure the concentration of fine particulate matter and are a better gauge of current air quality, was the highest in the north, standing at 74, which falls in the elevated band. NEA says for the next 24 hours, the hourly PM2.5 readings are expected to be between the normal band and the low end of the elevated band, while the 24-hour PSI is forecast to be in the high end of the moderate range. NEA also says rainfall this month is expected to be significantly below normal levels, continuing a trend seen since July.
There are two air quality indicators that Singaporeans can use to plan their activities. The first is the 24-hour Pollutant Standards Index, or PSI, which is calculated based on 6 pollutants, including sulfur dioxide, carbon monoxide, and fine particulate matter. The PSI readings are accompanied by a health advisory, which can be used to plan activities the next day. But if you're wondering if it's safe to head out for a jog in the next few hours, authorities have said it would be better to refer to the hourly PM2.5 readings instead. These measure the concentration of particles that are 2.5 microns or smaller of fine particulate matter. The hourly readings were introduced in Singapore in 2014. One expert says long-term exposure to fine particulate matter can cause health issues.
We're concerned about the level of PM2.5 because they are very small. They can suspend in the air for a very long time, and in the meantime they can also go into the deeper part of our respiratory system and cause more health impact.
There is no corresponding health advisory for the hourly PM2.5 readings. But Professor Lee says the public should be alert when hourly PM2.5 levels are above the normal range.
When the PM2.5 level is under the elevated level or above, even when the PSI number is low. So people should pay more attention and cautious on their outdoor activities, especially for those people they have respiratory disease and elderly. For example, they should reduce or minimize the time in the outdoor.
The public can visit the NEA website for updates.